Hello, people. I'm Dr. Mia from grandmamedicine.net. Check me out and my credential. Today, I have a question for you. Do you know what is cancer? Every time we hear the term cancer, we're afraid of death. But actually, cancer is just abnormal growth. Definition of cancer is abnormal growth. And that growth can be scary or can be kind. Another word is benign or malignant. Our dark spot on our skin is cancer, abnormal growth. Very natural to have abnormal growth at the cell's death or cell doesn't listen to anymore. But people that go check all the time with colonoscopy, you have polyp, that abnormal growth. Actually, it's natural to have polyps. It's just not too much. But if too much, diet and exercise can change it. But if you only cut the tip of it. The bottom, the root is still there. So you only treat the symptom. As always, like medicine, you treat the symptom and the side effect cure you. I call main effect, not side effects. So what is cancer again? Cancer is just abnormal growth. And if you grow too much, like blood cell, if you grow too much, become blood cancer. If your kidney grow out and affect your kidney function, then it's called kidney cancer. But sometimes it's natural to have abnormal growth. But the only way to control that abnormal growth best is diet and exercise, good nutrition. With chemotherapy, with surgery, chemo is called chemical therapy. Most people die from the treatment, chemical. I talk about how many people killed by doctor a year, right? 750,000. And if you have cancer, you go treat with chemical called chemo. Chemical therapy is chemotherapy for short. So they poison you and you live, they call resistant. That means it help you. But then a few years later, when cancer come back, good luck, buddy, shopping for coffin. Because after chemotherapy and you don't die, because your body's strong, you can handle the poison. But if you die, they say, I don't know, I treat you, I follow standard of care, you die, not my problem. So the death statistic I gave you that killed by doctor is only by mistake. But if you kill by doctor, that when they poison you or they do make mistake, do surgery on you, and you die, that not on the statistic that doctor killed. But doctor would not gonna admit they make mistake because they will get sued and you have money. But you know who need money? You need health. You need good health. Is number one priority. Unfortunately, our healthcare system should call sick care system. So cancer, looking for cancer mammogram. The more mammogram you do, the cancer rate increase. Why? Because the accumulation of radiation that from mammogram will accumulate in your system and it make your cell become abnormal grow. Anything that in your system chemical you cannot digest, long term, the cellular level of you will grow not normal. So for example, if you have blood cell, should be die in 120 days and recycle. Your skin cell every 28 days, it recycle. Your intestinal cell should be flush. If it's grow too big or it block your function, obstruction, then it's called cancer and you have to cut. Most people that have colon cancer are die from the treatment, not from the cancer. So the more doctor you go for testing, screening is called looking for disease care. And looking for disease care should not be your number one priority because that's not very smart. I mentioned before that the more doctors you go, the more diagnosis you label on your body, you will carry that labels and it bear you down and make you sicker. Same thing with looking for disease care like endoscopy when you have indigestion and they find out you have cancer and they want to cut your stomach and then cut your intestine and then let you go home. That is, to me, is very barbaric. Every surgery to me is barbaric. I cause mutilation. Surgery to prevent disease is not prevent disease. Prevent disease is diet and exercise always. So if you have some abnormal growth, it's very natural to take care of it with nutrition. It's smarter to take care with nutrition and herbs, other alternative treatment. If you go with medical doctor, oncologists, they don't even do chemotherapy, but they treat you with it because my friend's an oncologist, and I asked, and I read some study that they ask a question on doctor, would you do vaccine? No. Would you do chemo? No. And most doctors don't take medication, but they write to their patients. And I can't do that. If I don't do it, my patient would not do it. And I'm always give my utmost honest advice with a lot of study experience and a lot of reading from the research that to my come to my conclusion or come to my advice to my patient. So good luck, take care of your body. Ultimately, you are the person in charge of your health. So my goal is die fresh and quick. Until next time.